The lower extremities, this portion of the appendicular skeletal structure which we'll be looking at, are composed of 60 bones. In each extremity, we see the femur and the thigh, the patella, which we'll be looking at in this lecture, the fibula and tibia in the leg, then of course the tarsals, metatarsals, and phalanges associated with the feet. In terms of the patella, or the kneecap, this is a small triangular bone that is anterior to the knee joint. We'll be talking about the patella in relation to the knee joint. It is a sesamoid bone that develops in the tendon of the quadriceps femoris muscle. The broad superior end of the patella is called the base. The pointed inferior end is the apex. The posterior surface contains two articular facets, and these are used by archaeologists and bioarchaeologists and forensic professionals to be able to side the patella when they are found outside of the body or in a disarticulated state. One of these articular facets is associated with the medial condyle, and the other is associated with the lateral condyle of the femur. The knee joint is also known as the tibiofemoral joint. It is the largest joint of the body and actually consists of three independent joints. An intermediate patellofemoral joint between the patella and the patellar surface of the femur, and we have those condyles as landmarks to be able to distinguish that. A second, a lateral tibiofemoral joint between the lateral condyle of the femur, the lateral meniscus, and the lateral condyle of the tibia. We'll be taking a look at that in just a moment. And then that third component to the joint, or that third joint, is a medial tibiofemoral joint between the medial condyle of the femur, the medial meniscus, and the medial condyle of the tibia. So think about it a little more broadly. We have the first component to the knee joint, an intermediate patellofemoral joint. We have the second component, could be considered a second joint itself, a lateral tibiofemoral joint, again associated with those lateral condyles. And then a third, a medial tibiofemoral joint, again associated with the medial condyle of the femur, and then of course the medial condyle of the tibia as well. As you look a little more closely then at some of the physical qualities of the knee joint itself, and in the next slide I will have, in this case, another perspective, that more interior to the joint, to look at as well. There are a few important landmarks just to keep in mind because they're an important part of the architecture of the distal end of the femur and the proximal end of the tibia. You have a medial and lateral patellar retiniculum. These will, in a sense, be comprised of the tendons of insertion associated with the quadriceps femoris muscle and the fascia lata. We have a patellar ligament, a central portion of the common tendon of the insertion for the quadriceps femoris muscle. And we have a tibial collateral ligament, a broad flat ligament on the medial side of the joint. Now, what do these actually do? A lot of these are not only, of course, points of attachment for the muscles themselves, but they're also important to the strength of this very large joint. The joint is large, but it is also extremely weak by nature just because of the physics of this portion of the hind limbs or the lower legs. So these important ligaments, their condition, their strength, they're a big part of the strength of this synovial joint system. Now, internally, if we hyperflex the joint in terms of this diagram, what are some of the important landmarks and why are they important? Well, you can see that you have these articular discs, these fibrocartilaginous discs between the tibia and the femur, between the tibial condyles and the femoral condyles. They help to compensate for the movement of the bone and the amount of weight bearing that is occurring in association with this portion of the appendicular skeletal structure. Inside of the joint itself, attaching both the upper and lower portions of the lower extremities, we have important ligaments, and I'll just mention a few here. We have the medial meniscus, a semicircular piece of fibrocartilaginous material, again important to the overall strength of the joint itself. There is a lateral meniscus, again similar kind of structure, similar kind of material, more of an O shape in terms of its orientation within the body. And then the anterior and posterior cruciate ligaments. These are part of again, a system of intra-articular ligaments that are connecting the tibia and the femur. And all of these become important structural elements to the knee itself and how it functions. Remember that the human animal has a very unique design, both to the knee and the hip. Why? Because of its unique form of locomotion. We realize that the knees are more closely related or closely assigned to that kind of mid-sagittal plane, anatomical plane in the body. We have a lock-kneed stance, and again, the knees are, again, more underneath the overall weight of the trunk of the body, and that's very, very unique. It helps us to be able to stand erect for long periods of time, and then it's an integral part of our ability to be bipedal and to be as efficient as we are as bipeds. This same kind of closed and locked kneed design is also then related to what we see in the hips and some of the ligament attachments there. The strength of these joints, the importance of the ligament attachments, and the surrounding muscle structure, all of this is relatable to the biometrics and the biomechanics of both of these regions within the appendicular skeletal structure. And these are uniquely human. They give us our efficient ability to be able to locomote, and also they are a big part of our stature and our height. Again, I cannot emphasize that enough. All right, now let's get back to the tibia and the fibula. The tibia, or the shin bone, is the larger medial bone of the leg. It bears the majority of the weight of the leg and, of course, the individual. I would say for this reason, its use as an estimate of stature is extremely important. It is unique with regard to the growth and development of the lower extremities, and then its role as a major weight bearer, I think, makes it an important part of why its stature estimates, or estimates of stature that are drawn from the tibia, why those are much more reliable than we have in even the femur. The tibia articulates at its proximal end with the femur and the fibula. At its distal end, we have the articulation with the fibula again, and then we have an articulation with the talus bone of the ankle, and we'll be looking at that in our next lecture. In terms of landmarks, the proximal end of the tibia is expanded into a lateral and medial condyle. These are, again, associated with the same condylar design of what we have with the femur itself. The interior surface of the lateral condyle articulates with the head of the fibula. The slight concave condyles are separated by an upward projection called the intercondylar eminence. The tibial tuberosity on the anterior side is the point of attachment for the patellar ligament. And all of these then become important landmarks. The medial surface of the distal end of the tibia forms the medial malleolus. This structure articulates with the talus bone of the ankle and forms the prominence that can be felt on the medial side of your ankle. The fibular notch articulates with the fibula, and that's what we'll be looking at next. The fibula is parallel and lateral to the tibia. It is considerably smaller than the tibia, and in terms of weight bearing, we would consider it to be a non-weight bearing bone structure in this portion of the leg. The head of the fibula, the proximal end, articulates with the anterior surface of the lateral condyle of the tibia below the level of the knee joint. The distal end has a projection called the lateral malleolus, and this articulates with the talus bone of the ankle. This forms the prominence on the lateral side of the ankle, which again you could feel. The anterior portion of the fibula also articulates with the tibia and the fibular notch. Now, fractures happen to even this lateral bone. The fracture of the lower end of the fibula, which is very common, this injury is called a Pott's fracture, and we see this in a lot of different sports-related injuries of the lower leg. Now what I've done here is I have taken the image from the previous two slides and I've blown it up a little bit for you. Take a moment to pause the lecture, compare some of the landmarks that you see in this imagery, again both anterior and posterior. Take a look at some of the characteristics and landmarks as they relate to siding each of these bones in these images, and then compare all of that to your BAS text. Now, when we talk about the overall architecture of the bone structure in the appendicular skeletal system, again, we can't disconnect it from the joints that are associated with it in proximal and distal locations, let's say to long bones. We can't really disassociate it with the biomechanics of weight bearing, the role or the function that it plays in the skeletal system, and its growth and development. The other thing we can't really separate it from is the muscle structures themselves, those that surround these bones and are an integral part in the overall movement that we associate with the appendages. So we have a lot to look at. However, what I'd like to do is I'd like to focus on those particular kinds of superficial and deep muscles that are important to the biomechanics of the lower legs themselves or the hind limbs themselves. I'd like to focus on things that are important in anthropological literature as they relate to topics of evolutionary biology and of the functionality of the appendicular skeletal system as it relates to things like locomotion. And that's especially the case when we're talking about the legs and their overall structure and function. So in terms of some of the major muscle structures that I just want to point out for you and talk a little bit about the action, we'll start out with one that brings us into the upper portion of that lower extremity, the quadriceps femoris. Now this is a complicated muscle when we're talking about origins and insertions, but not so much in terms of action. Usually when anatomists talk about the origin of the quadriceps femoris, they break it down into really four heads or four locations for its origin. Generally, what is this doing when we kind of bring all of these points of origin together? It is bringing together landmarks such as the greater trochanter and linea aspera of the femur, along with the anterior inferior iliac spine of the pelvis. So think more of kind of that hip joint and the anterior portion of the pelvis, and also consider its orientation, right? It's going to originate above the acetabulum, and then the overall orientation of the pelvic bowl is it's tipping forward. And that's important for the kind of stability that's required by this muscle and eventually what its action is. In terms of the insertion then, we're going to recognize kind of the upper portion or the upper border of the patella as being very, very important. And I mentioned this when we were looking at the knee joint itself. The other important insertion that we will want to associate with the quadriceps femoris muscle is the tibial tuberosity, again associated with the patellar ligament and the knee joint. all of these become very, very important locations in association with the movement. So what is the action? Well, generally, all four heads of the quadriceps femoris and its origin are going to be an integral part of, in this case, flexing the thigh, and it extends the leg. So flex the thigh and extend the leg. And it's, again, a very important part of our bipedal locomotion. And it, in a sense, is a muscle that very much connects the overall architecture and functionality of the femur and the hip with the tibia. All right. Another important major muscle that we want to focus in on with regard to the architecture of the bone structure in this portion of your skeletal system is the biceps femoris. This more posterior flexor muscle is not as complicated as what we saw with the quadriceps femoris in terms of its origin, but it still has a bifurcation for that origin. So again, bicep. In this case, the origin that we'll associate with the biceps femoris is the long head is going to arise from the ischial tuberosity of the pelvis. So think about kind of that posterior and more inferior portion of the pelvic region, and one of three important parts for the development of the pelvis. So the ischial tuberosity. And then the short head is going to arise from the linea aspera of the femur. Now, where does it insert? So we have the origin with the ischial tuberosity and the linea aspera. Now, where does it insert? It inserts with the head of the fibula and the lateral condyle of the tibia. So the head of the fibula and the lateral condyle of the tibia. What does this do? It flexes the leg and extends the thigh. Again, two important movements with regard to locomotion. It flexes the leg and extends the thigh. All right, a couple more for you to consider. Again, moving now down into more of that lower portion of the leg. We have the tibialis anterior. The tibialis anterior originates with the lateral condyle and the body of the tibia, and then it will insert in the first metatarsal bone of the foot. Well, what is this action, or what is the action associated with this? This is going to be a dorsiflexion and an inversion of the foot. So it's going to flex the foot and invert the foot. Dorsiflexion and inversion. So the tibialis anterior is important to the movement of the foot and ultimately the toes. This will give us pretty good abilities with regard to planting and pushing as we are locomoting. So the tibialis anterior. If we look at the tibialis posterior, this puts us into the posterior portion of the leg. The origin is going to be the shaft of the tibia and the fibula, so it's connecting directly to, in terms of that anchor, directly to the bones we're looking at in this particular lecture. And then it is going to insert with bones of the ankle, and we'll be covering those in our next lecture. What does this do? It's for, again, plantar flexion and inversion of the foot. So it really gives us that nice stability as we plant in the kind of biomechanics of moving forward, thrusting our weight and the force of our body as it relates to locomotion forward, that plantar flexion, and then inversion of the foot. So the origin in this case is going to be important for or is going to relate directly to the tibia and the fibula. We have the extensor digitorum longus, another important muscle, again associated with movement of the foot and toes. The extensor digitorum longus will originate with the lateral condyle of the tibia and a portion of the fibula, and then it will insert with the middle and the distal phalanges of the fourth to the outer toe. So the idea here is that it's giving us that kind of lateral leverage here. It allows for dorsiflexion and eversion of the foot and extension of the toes. So it's really giving us a lot of movement and stability to the kind of lateral portion of the foot as we are planting and pushing off in that locomotion behavior. So the extensor digitorum longus connecting the tibia with the middle and distal phalanges of the foot. In terms of plantar flexion, then we have the flexor digitorum longus. The flexor digitorum longus will originate with the posterior surface of the tibia. So the tibia is its anchor. And then the insertion is going to be the distal phalanges, again, of that fourth and outer toe. So plantar flexion is important here. It will help to avert and flex with regard to the toes. But again, the origin is going to be that lower portion of, or the posterior surface, rather, of the tibia, and then the distal phalanges of the fourth and outer toe. Another important superficial muscle with regard to the biomechanics is the gastrocnemius muscle. The gastrocnemius muscle, again a superficial muscle associated with kind of the posterior portion of the lower leg, again associated with movement of the foot and the toes. The origin for this particular muscle is going to be the lateral and medial condyles of the femur. The insertion is going to be associated with the Achilles tendon. So it's going to be associated with, in this case, the kind of distal segment of both the tibia and fibula. What is this important for? Again, plantar flexion of the foot and overall the flexing of the lower leg. So plantar flexion and overall flexing of that lower leg. And then the last muscle I'd like you to associate with this portion of the lower appendages is the plantaris muscle. The plantaris muscle is going to be important again for plantar flexion of the foot. In terms of its origin, we're going to recognize it to be associated with the femur above the lateral condyle. So lateral condyle, femur, just above the lateral condyle and femur. And then again, that Achilles tendon and the calcaneus bone that we will be looking at when we are examining the architecture of the foot. So the calcaneus, by way of the Achilles tendon, will be something to relate to the insertion for the gastrocnemius and the plantaris muscles. That's their insertion. And then, of course, we talked about their origin. For the gastrocnemius, it's going to be the lateral and medial condyles of the femur, and for the plantaris, the femur just above that lateral condyle. Plantar flexion of the foot is what I really want you to associate with these two superficial muscles of this region.